Okay, in this video, I would like to talk about a question one of the doctors asked in the group. So the question is about how should I prepare, what materials should I read, and how should I practice. So preparing, I have already done a video on how to prepare. So if you have not watched it yet, you probably have to go back and watch it. So that is how I will, start the preparation. I told my strategy on what I was thinking, and let me just use a different pen. So the strategy I used and how I was thinking, I always start with psychiatry because that was the toughest one. I might just link that video somewhere here. So don't worry, you will still get it. So psychiatry was the first thing, then I focused on gynae obs, then peds, finally after surgery I read medicine. So there is a thought process. I was thinking, why I chose psychiatry, the confidence I got after I passed psychiatry, why gynae obs, how did I prepare, and that's a pure strategy session. I don't think anyone will know it because that's something I created for myself. So that's the preparation way. Then coming to the material. So material is a very tricky one. It depends on your style. Many people say, Dr. Talari, I read John Murtha, I failed. I read Karen notes, I failed. I attended this course and still I failed. So material is something you need to figure out what is your style, what is it you are lacking. So that's how I will do. What is it you are lacking, and what are your strengths and weakness is what will determine your material, and the practice is the same. So if you're someone already working in the healthcare system, that will give you a massive advantage. So my advice is you should actually do role plays with people who are working in the system. Don't listen to these people, or don't learn from people who are actually not working in the system, because if they don't know how to deal with a Australian patient or a real patient, what the hell are they going to teach you? If they don't know the guidelines, if they don't know the protocols, if they don't know what happens when you refer, if they don't know what happens in the emergency department, unfortunately such people are teaching, and people are actually paying happily money and happily failing. They're getting gratification that they're learning from someone who's probably teaching what the book says anyways, but probably got some PDFs or listened to some of my videos, or they purchased my course in the past, they failed the exam, but now they're teaching. So don't learn from people who are not working in the system, because these people have no idea of what's happening, and that's what will make you fail the exam. So my advice is practice with someone who is already working. And I'm actually seeing a massive need for coaching. So I'm actually going to open up a weekly group coaching program. So at a ridiculous price. The reason is I wanted to help as many doctors as possible pass this clinical exam, get into the system as soon as possible. The reason is over the next 3 to 5 years, there will be a lot of nurse practitioners and pharmacy practitioners coming in. Then I don't think you will have a chance to work in the system, because when there is no need, they will not let you in. It's like dental practitioners. There's not much need for dental practitioners, so they don't pass many doctors or many dentists. So it'll be the same. So if there is a golden window, it is now. If you don't do it now, it will be never. You will never be a doctor in Australia. So my advice is get the strategy right, get the material, practice with someone. I wanted to do a group coaching program. I wanted to make it as affordable as possible because I want to help as many doctors as possible. I make money working full-time as a doctor, so I don't want to make any money from you guys. but ultimately, you know, my time is valuable, you know. So if I teach someone, I want to, you know, be rewarded for my time as well. So for all the effort I'm putting in, I will be charging a very basic fee, but I can 100% promise you that this will be the best role plays, this will be the best strategies you will learn, because you are learning from someone who has been working in the system, who is an FRACGP educator, who has done mock exams, who has written cases for mock exams, and you know, who is very passionate about teaching for AMC clinical and OSCEs, teaching for medical students. So I wish you all the best, and I will see you in the next video.